Welcome to Harris Health System, a community-focused academic healthcare system dedicated to improving the health of those most in need in Harris County through quality care delivery, coordination of care, and education. Our vision is to become the premier public academic healthcare system in the nation. Today, we're going to be showing you a glimpse of what the pharmacy department looks like within our facilities. At Harris Health System, the pharmacy department plays a key role in the healthcare of our patients. We pride ourselves in the mission and the vision of our department, which is world-class pharmacy, recognized for excellence, and to deliver optimal medication management across all dimensions of care every time. Today, we're going to start first off at Ben Taub Hospital, which is our Level 1 Trauma Center. Let's go take a look inside.
Hi everyone, and welcome to Ben Taub Hospital's Administrative Office. Here, you'll find where our Director of Pharmacy is housed, as well as our Administrative Assistant, Miss Angela. Hi, Miss Angela.
Hi.
Hello. And coming along this way, this is typically where normally our meetings are held and where you will be meeting with your preceptors on a daily basis while on rotation. In this area is where our clinical pharmacy specialists are located. So we have specialists in emergency medicine, infectious disease, NICU, MICU, SICU, anything you could ever dream of. But this is normally where you would spend your day when you're on a clinical rotation at Ben Taub Hospital. And finally, over here is where our lead technicians would normally be located, and we have our 2 operation manager offices here in the back. So when you're on an administration rotation, you would be spending most of your days here, participating in meetings and contributing to different projects that our department has going on.
Alrighty everyone, so here we are at Ben Taub's inpatient pharmacy, where we'll show you around the place so you can get to know some of the roles of pharmacists and technicians on a daily basis. As you enter the pharmacy, you see the charge pharmacist, who is in charge of making sure the pharmacy runs well for their allocated shift. Behind her, we've got our 3 automated med carousels that help with medication order fulfillment and to make the process much smoother than doing it unautomated. On this side of the pharmacy, we have our rolling shelves, which are also tied in with our automation, but these ones are used to store our bulk items. In the middle of the pharmacy, we have our triage area where technicians assist in allocating and moving medication orders to the appropriate person. On the right-hand side of the pharmacy, we have our order verification pharmacists, who are consistently checking orders as they come in from physicians, as well as adjudicating any issues. And at the very back of the pharmacy, we have our IV clean room with our IV pharmacist and our chemotherapy pharmacist helping with our orders. We are proud to say that we have a USP 800 compliant, brand new state-of-the-art IV clean room behind us. As a resident, you will have a staffing component that you will move into the different pharmacist roles and assist with the inpatient operations. Okay, so continuing on in the inpatient pharmacy, this way we have our crash cart preparation area where technicians and pharmacists stock all of the medications in the crash cart drawers. Along this back wall, we have our refrigerators and freezers to store any of our batch IV preparations as well as immunizations. Down here on the right-hand side, we have our chemotherapy IV sterile room for all hazardous drug compounding. And then lastly, on the right over here is our hazardous drug storage for chemotherapy and all USP 800 medications. Okay, and so for the final area of our inpatient pharmacy, we have our non-sterile compounding. Here we take care of any oral solutions drawn up into unit doses, such as for our pediatric population. The machine you just saw there helps us to unit dose any pills that don't come in that form already. And then as we continue on down this way to the back of the pharmacy, you will see our narcotic vault where we have our controlled substances stored for safe storage. So now we will take you guys to one of our patient care areas down in the emergency department. Alrighty everyone, so the next thing we're going to show you is a little bit of our emergency department here at Ben Taub Hospital. Like we've mentioned before, we are a Level 1 Trauma Center staffed by the Baylor College of Medicine physicians, faculty, and medical students. Here at Ben Taub, we have 5 critical care shock rooms, and we'll be showing you one of those so you can get a feel as to what it would be as a pharmacy resident. So here is one of those shock rooms. As a resident, you will be an integral part of the team managing the patient. You will have times where you will help take notes. You can draw up any type of medications, pull drips. There's a great part that is, involved with the pharmacy team here. Once the patients have gone through and been worked on here in our acute care area, we then would triage them to either going to surgery, going to the internal medicine unit, or maybe critical care unit. For a complete look at our emergency department, the next area that we'll show you here is going to be that area where patients are decided whether they get to admitted or discharged. All right, so on our way to the emergency department patient care holding area, we wanted to show you one of our Pyxis machines. These devices are used to aid in medication delivery, and as a pharmacy resident, we assist the nursing and physician staff with any medication delivery issues or management along the way. We'll walk on over this way to show you one of our patient care rooms. Here, patients will be evaluated so that we can determine if they are candidates for discharge or if they are someone who needs to be admitted for further care at our hospitals.
Here we are at the Smith Clinic, one of many specialty facilities within the Harris Health System. This clinic is known for its oncology services, but also houses various specialties and diagnostic services as well. I'm going to take you inside and give you a little bit of a tour of what the pharmacy department looks like. Welcome to the Smith Clinic. This is one of our outpatient pharmacies that I'm going to take you on a tour. Come on down. This is one of our locations where all of our technicians sit and station for preparing the medications. We have here our narcotic vault, and then along the walls back here, we're going to have all of our medications that are separated by tall men lettering, specialty, and hazardous drugs. Right here is where we have our pharmacists sit and complete order verification and counseling and prepare their medications for the patients. The back wall right there is where we have our windows for our patients to complete point of sale, and then as well as counseling and any other services that they would provide. Stationed behind our outpatient pharmacy, we have our chemo and sterile compounding rooms. Recently, we went through an upgrade to stay in compliance with USP 800. So these are what our compounding rooms look like right here. Right behind that, we have the infusion work area where our pharmacists will sit and conduct any compound or IV order processing. We're going to go upstairs next and see where our clinical pharmacists provide clinical services to all of our patients. So continuing on at the Smith Clinic, I'm going to give you a little bit of tour of what the exam rooms look like. So if you're on rotation and your primary care rotations or any outpatient clinical rotations, this is where you'll be. So start off with, this is where our nurses station is and where you'll be collaborating with them. If you have any questions regarding your patients, you'll come talk to them right here. Moving forward, we have our work area right there, and this is where our physicians sit, our students, even yourself if you were conducting any topic discussions with your preceptors. And then lastly, I wanted to show you our exam room, where while on rotation, you'll come in and talk to them about consultation, any clinical pharmacy services that we provide in the specialty clinic at Smith Clinic.
Hello and welcome to the Lyndon B. Johnson Hospital. Today I'll be your tour guide through both our inpatient and outpatient pharmacy. Now before we get started, I wanted to talk to you a little bit about our outpatient hospital. First off, it is considered to have one of the largest and busiest level 3 trauma centers, as it had over 80,000 visits to the ER for the last year. Additionally, it is currently staffed exclusively by some physicians, residents, and practitioners affiliated with the UT Health Science Center here in Houston. Now, let's go ahead and dig in. First off with our outpatient pharmacy. Now, as you walk through, you'll start to notice that there are several stations, each one staffed with either a pharmacy technician or a pharmacist who are currently preparing medications to be dispensed. Towards the back, you'll start to see some windows where our patients actually come through to pick up their prescriptions.
Yeah, for real, thought of that.
Now, it should be noted, as a PGY1 resident, you aren't incorporated directly into the workflow of the outpatient pharmacy. But it is important to note, as this outpatient pharmacy is contributively and directly included or connected to our inpatient pharmacy. Alright, so now the first thing that we'll look at from our inpatient pharmacy is a narcotics vault located over here, which, as you can see, is consistent of 4 different cabinets, each one facing several of our controlled substances. Now, we'll walk down, and as we exit our outpatient pharmacy, we'll transition onto our inpatient pharmacy, as mentioned there directly behind. To your right, you'll notice the non-sterile compounding area staffed by both our technicians and our pharmacists, where we both pre-pack any unit doses that later go on to our patients in the inpatient side. Now, we'll continue to walk, and to our left, you'll see our IV room, and we actually have a small drawer where we actually can speak with the technicians in the IV room. Here you'll see the clean rooms and the anti-room, as well as the chemo room towards the back. Alright, now continuing, first thing we'll see here on our right is our tube station, which distributes to all 4 floors here at the LBJ Hospital. Now as we walk through over here, you'll start to see the station where we have our pharmacists, each one tasked with a specific task, but again also collectively helping our pharmacy department run. We'll continue forward, and we'll see here our central station where a lot of our technicians go ahead and prepare medications to be dispensed. And we revolve over here. Those are stations for our pharmacy technicians. And here we see the 2 carousels that operate all of our medications. And then we move forward, and we see here our crash cart station, where we stay busy by replenishing all the crash cart trays. We move forward, and as we turn to our left, we start to see our rolling shelves where all of our large volume medications, as well as the refrigerators that contain all of our refrigerated drugs. Thank you all again for joining us on a tour of some of the facilities here at the Harris Health System. We'd like to thank you all again for considering Harris Health System as one of your choices for a pharmacy practice residency. Thank you again, and we hope to see you on site soon.